Professionals in my car. I'm Oscar Montenegro. Today I have Dr. Jarrod Nichols in the hot seat. He's the president of Nichols Chiropractic and Nichols Therapy Systems. Dr. Nichols, thank you so much for being in the hot seat
Oscar,
this morning.
it's good to be here.
It's a nice chilly morning this morning, so we're going to get right into it. Tell us what you specialize in, you and your group.
So I'm a chiropractic physician as well as an entrepreneur. So we specialize in restoration and maintenance of spinal health to promote overall health and quality of life improvement in our patients.
Okay. And how long have you been doing this for?
So 11 and a half years.
Okay. And so tell us what does it take to be a leader in this industry from the standpoint of how do you set yourself apart from the competition?
So, Oscar, you being a health conscious person, you understand that health it's a process, it's a journey, not a destination. So I think one of the things that's made us successful in the community here is that, we aim to create genuine relationships with our patients that aren't just, condition specific. So, for example, somebody might come in with low back pain, after raking leaves over the weekend. We can not only help them through that episode, but also build a relationship where in the future, maybe it's something else. Maybe they have headaches, or maybe their spouse is pregnant with low back pain or sciatica. So really it's becoming a resource for our patients and our patients' families to be able to provide advice and services to them in order really to improve their quality of life overall.
Makes sense. What does it take to be a leader of people? So you have employees. So what does it take to lead those folks to execute on the common goals of the organization, your organization in particular?
So I think given them the freedom to build those genuine relationships with our patients when they come in the door, each time they come in for a visit, our team, genuinely wants to know how their family is doing, how their kids are doing in sports or activities, various things like that.
Mm-hmm.
So really just allowing my team to enjoy the people that we're serving.
Doctor, what does it take to create other chiropractors with the leadership competencies that you're talking about? So how would you go about duplicating yourself? What does it take to be a good chiropractor like yourself?
So I really think we've tried to create a clinic where we've taken multiple individual providers and we've brought them under one roof and really have centralized and consolidated a lot of the management of the business of the clinic to one person, being primarily myself. And so really that opens up the other doctors to focus on patient care, which is what we're all trained to do. So, the business aspect of the clinic is something that we don't get a lot of training in. I've had great mentors in my life that have helped me build good business processes and procedures to help it become successful. Sure. Not everybody has access to those or seeks those out or has the interest to do that. So what we've tried to do is create a clinic where doctors can come in and they can treat patients, they can do what they're trained to do, and they don't have to split their time between patient care and administrative.
One last question, and I think it's an important one, and that is, what is one thing that people can do starting tomorrow to get on the path of effective leadership?
So I think really putting people first is probably the one thing that people could do, right now. So people tend to follow the people who show a genuine interest in them, in making them better, in investing in them. And so I think no matter what position you hold in a company or an organization, asking questions, learning about the people around you, building those genuine relationships, then you're really leading by example. People are just going to naturally follow you. You're not, requesting that they follow you as a leader,
Sure.
right? It just comes naturally. So I think putting people first, building those genuine relationships, and really looking beyond yourself, helping other people become a better version of themselves is I think where a lot of it starts. And then you have this great trickle down, for us is to our patients, because when our staff, when our team is feeling good and doing a great job and able to really execute on the things we need them to, that translates into better patient care.
Doctor, thank you so much for getting in the hot seat. I
Thanks,
appreciate it so much.
It feels good. It feels good.
Yeah, the heat's on, so we'll be seeing each other soon.
Sounds good.
All right, have a good day.
You too.